Glad you could make it a date with us today on EarthFile. Welcome to the program. I'm Ayola Kasim. The United Nations 193 member states have agreed on an agenda for the world's sustainable development over the next 15 years that pledges to leave no one behind. The new Sustainable Development Agenda builds on the success of the Millennium Development Goals, which helped more than 700 million people escape poverty. The new Sustainable Development Goals and the broader sustainability agenda go much further, addressing the root causes of poverty and the universal need for development that works for all the people. Today on the program, we focus on some of the goals and how this can affect every Nigerian. Just stay with us. A look at the latest data released by the United Nations on Development reveals the planet isn't doing so badly in some respects, and that people's lives, if looked at on a big scale, have been continuously improving over the last 2 decades. The Millennium Development Goals were intended to serve as a precise, memorable and measurable way to focus development policy in the first years of the 21st century and to improve the lives of hundreds of millions of the world's poorest people. The United Nations says in 1990, nearly half of the population in the developing world lived on less than $1.25 a day. That proportion has dropped to 14% in 2015. The number of people belonging to the working middle class living on more than $4 a day has almost tripled globally since 1990. In developing countries, the proportion of undernourished people has fallen by almost half, from 23.3% in 1990 to around 13% today. Despite the achievements of the past 15 years, the agenda on poverty is far from complete. More than 6 million children under 5 still die each year, and preventable causes such as diarrhea, pneumonia, malaria, and preterm birth account for 83% of these deaths. Hundreds of millions of children are still chronically undernourished, and much work remains to reduce maternal mortality. Not surprisingly, the families are among the poorest in the world, with the least access to healthcare, nutritious food, or education. Improving health outcomes for women and children in developing countries is the foundation of a better life for people living in poverty there. Yet, health is only one aspect of a full, productive life. Ensuring that women and children thrive, it has been recognized that other factors such as education, nutrition, sanitation, and economic empowerment of women and their interplay with health must be provided. The period of the Millennium Development Goals saw child mortality falling by half between 1990 and 2015, from 1 in 5 children globally to 1 in 10. The goals fired global ambition by calling for a 2/3 reduction in under 5 child deaths over this period. As of this year, the rate of progress in reducing child mortality in sub-Saharan Africa has increased 5-fold since 1990. But it has also required countless focused and coordinated efforts by governments, donors, the private sector, health institutions, non-governmental organizations, and community groups. In 2014, the World Health Assembly endorsed a global effort, the Every Newborn Action Plan, to accelerate progress in newborn health. In recent months, countries like India, Nigeria, and Ethiopia, with some of the highest rates of newborn deaths, have announced ambitious efforts to reduce newborn mortality. These efforts have just begun, but building on this momentum, experts are optimistic the global newborn mortality rate can be brought down to 1.2% by 2030. The United Nations also revealed that although significant achievements have been made on many of the MDG targets worldwide, progress has been uneven across regions and countries, leaving significant gaps.
Nigeria was able to record, some strides when it comes to the MDG goals 4 and 5. For MDG goal 4, the main thing there was, trying to reduce the under 5 mortality. reduce the infant mortality rate and increase the immunization coverage. Based on all the statistics that we were given about last week, during the World Polio Day, we did see that Nigeria has been able to really achieve that great stride in polio coverage with respect to the immunization. And for even the infant mortality rate, over the years, we've seen, a relative decline. But we also understand that there are still some social determinants of all this. When we talk of from the northern region, you look at the insurgency, to the eastern region where there is a lot of kidnapping, and you also have a lot of baby factory machine that, and then coming back to the west where you have a lot of robbery. Basically, I can say that security is one thing that has really affected, if indeed the MDG has not been able to be achieved the way we would have wanted it. We've not been able to, kind of meet the expectations. I think all those social factors are things that the government, the stakeholders need to look into so as to be able to forge ahead, looking at this sustainability era.
Millions of people are being left behind, especially the poorest and those disadvantaged because of their sex, age, disability, ethnicity, or geographic location.